sir, we are ready to go live.
Great. Thank you, Vaishali. Good evening, friends. My name is Shrenik. I am from Ahmedabad, and I'm stage 4 vocal cord cancer survivor, and currently in my 28th year. I am having a fascinating privilege of becoming a patient ambassador and moderator of live webinar on behalf of Indian Cancer Society Delhi branch. Friends, we are conducting this seminar or this live session for knowledge sharing by expert cancer specialists from all over India, and we do our best to bring the top of the line surgical, radiation, clinical, and medical oncologists on this platform. And I guess this is our 10th. No, this is our 11th session since we have started this live session. Today, I am thrilled to introduce our dear friend. I rather always used to call her Sergeant. Sergeant, she is a sergeant with a smile, our hours, and she is interacting with it not only with patients but caregivers and all over the staffs. I mean, 24/7. She is the person you can call her even at 12 o'clock midnight and she will answer everything without any hesitation. So let me welcome Dr. Purvi Patel. She is a head and neck cancer surgeon and she is the one who is performing uh, unstoppable surgeries. At times, something like 10 to 12 surgeries, in 48 hours. She is rather playing a master stroke as a surgeon. So, Madam Puri, Dr. Puri, Madam, welcome on board, and stage is all yours. Thank you.
Thank you, Shrenik Bhai, for such a kind and elaborated introduction. So thank you so much. I'm really thankful to Indian Cancer Society Delhi branch for giving me this opportunity. Because of you all, I'm here. As you all know, my topic is on salivary gland neoplasm, or neoplasm means tumors. So salivary gland tumors, and I will describe everything. After we talk, we can have some question answer session as well, right? So salivary gland tumors we treat every day, and like we have a lot of patients of salivary gland tumors, and that is why Shrenik Bhai has selected those who are head and neck surgeons. They can brief or they can discuss about all this head and neck related malignancy, right? So what is salivary gland tumor, or what is salivary gland? So what is salivary gland? So salivary gland is a gland in our body which secretes saliva. And so we have six major glands in our body. Uh, Two are here, just in front of ears. They are known as parotid. Two are below the chin. They are known as submandibular glands. And two are below our tongue. These are known as sublingual glands. So whenever you eat something sour thing, you see sudden flow of saliva will be there. So all these glands, they are opening in our mouth. There are channels, ducts, and they are opening in our mouth. So whenever you see something tasty and saliva flows in your mouth, that is because these glands are working and throwing saliva in our mouth. So yes, salivary gland also can have some tumors, right? So, but majority of these cancers are usually benign. Benign means they are not cancerous. It is called tumor. Whenever there is a swelling in the glands, we call it tumor. But though all these tumors are not cannot be cancerous, so it is very important to differentiate. So sometimes whenever patient comes with a swelling, we have to see whether it is cancerous or not cancerous. So 1 out of 5 patients will have only cancerous salivary gland tumor. Rest 4 can have normal, simple kind of swelling, which we call it benign swelling, right? Apart from the 6 major glands which are there, we have more than 600 minor salivary glands in our body, especially in the mouth. They are in the lips, they are in the tongue, they are in the palate, they are in the base of the tongue, and even over the voice box area. So these are 600, more than 600 minor salivary glands are also helping our major glands in making saliva. These glands also can have sometimes tumors. They can be benign, they can be cancerous. So this is very important when we talk about salivary gland tumors. It is all major glands and the minor salivary glands as well. Now, what symptoms patients can have when they have such salivary gland tumors? So when they have a tumor, usually they start seeing any swelling in that area, particularly in the parotid or just below the chin. It starts with the swelling. Usually they don't have pain in the initial part. But as the swelling grows, they might the swelling might be visible, they will start having some stretching kind of pain. And if it is cancerous, it might affect the nerves in the area. Nerves are there. One is very important now, facial nerve. It is here, it is just running behind the parotid gland and supplies the all muscles of our face. So this facial nerve is just lying below the gland. And if the tumor is cancerous, we just neglect it. Patient does not go for a consultation, does not go for another like further treatment, and the swelling might affect the nerve, and then patient will have a facial weakness. Similarly, if they have a submandibular gland, salivary gland tumor, they will feel a swelling over here, and it might affect another nerve which is supplying the tongue. So their tongue movement gets restricted. And another nerve is sensation also. So they have a weird sensation in the mouth. Apart from this, they can have pain when they open the mouth. If the tumor is large, if it is big, they have restricted mouth opening, trismus, like this. So all these symptoms can be there, but usually the first symptom is swelling, and it is very visible. If it is in the major salivary gland, it is always visible. So that gives patient an idea like, yes, there is something going on in this area. If it becomes very advanced, if it is cancerous, as I said, 1 out of 5 patients will have. So once it becomes cancerous, it might involve the jaw muscles, jaw bone, skin, and it might go up to the our brain areas also. So that is the reason any symptoms in this area should not be neglected. Uh, If swelling is there in the minor salivary gland, again it will be showing a bump in the mouth. So maybe inside the lip, maybe inside the palate, maybe in the base of the tongue. So even the tumor of the minor salivary gland will show a bump, smooth bulge or bump will be there in the mouth, and gradually it increases in size. So all the symptoms should be kept in mind that they should not be neglected. Now, why patient develop salivary gland tumors? So yes, those who are having tobacco chewing, we know mouth why do mouth cancer happen? We know why do breast cancer happen. There are a lot of risk factors are there. But in salivary gland tumors, there are not many risk factors. There are few I can just name. Those risk factors are there, but that does not mean that if patient does not have a risk factor, patient cannot have salivary gland tumor. They can have without any risk factor also. So this is a gland where without any reason you can have a tumor. Now, what are the risk factors? So old age is one of the risk factor. So when our age is like we are aging, and age and cancer has a lot of a correlation. So as the age advances, any tumor can come any organ of the body. So salivary gland also, if age is a factor. Another risk factor is smoking. So smoking can affect tobacco chewing, and smoking can affect salivary glands, because smoking and the smoke can affect the salivary gland areas, and their patient develops usually Warden's tumor, which are not the cancerous tumors. They are simple glandular tumors. They are not cancerous. But yes, if they smoking continues their smoking, the tumors get expanded and it will be visible. And usually those who are smoker, they have bilateral Warden's tumor, both side of the gland. They show, both parotid gland shows the Warden's tumor. It is one of the benign type, not cancerous. Those children who had taken radiation in their childhood, they might have a possibility of developing salivary gland tumor later in their life. So, yeah, radiation exposure is one of the cause of a salivary gland tumor. Those who are working in some industries like rubber industries, nickel industries, so they have this occupational hazard. They are likely to develop salivary gland tumors because of the exposure of the rubber and nickel. There is one viral infection also, Epstein-Barr virus, and which can initially infect this salivary gland, and then later on this glandular cells start increasing, and then they develop tumors. So these are some named risk factors, but even we see patient does not have any risk factors. Patient is young, patient does not have radiation exposure, patient is not smoking, not working in rubber nickel industries, but still they can have salivary gland tumors. So there are some patients, those who are not having any risk factors. But yes, those who are having some risk factors, they should be aware that any tumors in this area should not be neglected. Now, as I said, there are two types. One is cancerous, one is non-cancerous. Non-cancerous tumors are, like I can say in our medical terms, might not be very worth understanding. But yeah, there are pleomorphic adenoma, Warthin tumors. There are some basal cell adenoma kind of tumors might be there. We have seen TB also in the salivary glands. So that is also one of the important things. Whenever patient comes with a tumor, it does not mean that it can be cancer. That can be TB also. TB can happen to salivary glands. Then there is one tumor called lymphoma that can also go to the salivary gland. Some patients come with a salivary gland tumor, they have just viral infection or some infection in the salivary gland, and they see the swelling. But those swelling comes with fever, they will have a pain, lot of pain, and there is some signs of infection will be there. So those things should be differentiated from the salivary gland tumors. Another entity which we see is sometimes some patients will have a stone in their salivary ducts. So as I told you everyone, like there is a salivary gland, it drains into our mouth, and there is a salivary duct. So this duct might have stone, just like we have kidney stone. And if the stones are there, the salivary, it will stop saliva flowing from the salivary gland to the mouth. It will block the saliva, and that's why the patient develops salivary gland swelling. So that is also very important entity. We have to differentiate it whenever we think about salivary gland tumors. Now, when we discuss about cancerous part, so cancerous tumors are adenocarcinoma, acinic cell carcinoma, mucoepidermoid carcinoma. There are a lot of varieties, more than 15 varieties of cancerous types of salivary gland tumors can be there. And usually it is diagnosed by the histopathologist. The pathologist report them. Now, what to do when you observe such a swelling? So it is very important, if you are observing a swelling which is not subsiding within week or 2 weeks, better to consult a physician. Means not onco physician. You can go to surgeon, you can go to ENT doctor. Your general physician also can guide you whether it is infection, something else, you have salivary gland tumors, like that. So consult your physician is very important. Once they consult, they see you, and then they realize, like, yes, it is something is going on, then that swelling needs to be evaluated with other investigations. So what are the investigations? So sonography is the simplest, most investigation which we do for salivary gland tumor. It is the first investigation, right? And in that investigation, you can differentiate whether there is a stone there, whether there is an infection, whether it is tumor, whether it is cancerous or non-cancerous, like that. So sonography has to be done. If in sonography it is found like it is a malignant, it is a cancerous, or it is a tumor which needs to be addressed, then the next investigation will be to do a biopsy from that area. And biopsy should not be done just by a surgeon or clinician in the clinic. It has to be done with the help of ultrasonography. Because see, this is the very important area. As I said, a lot of nerves are going just below the parotid and submandibular gland. We might hit those nerves, we might damage those nerves. So better it should be done under the ultrasound guided biopsy should be done. And once the biopsy is done, it is sent to the pathologist. Pathologists find out whether it is cancerous, whether it is non-cancerous, if it is cancerous, what type of cancer. Because as I said, more than 15 varieties of salivary gland tumors are also there, even in cancerous area, cancerous tumors. So the pathologist will dictate what type of tumor is there. Depending on that, the patient needs further investigation and treatment. Once it is documented that yes, this patient is having salivary gland tumor, whether it is benign, means non-cancerous or cancerous, we have to do MRI. MRI is one of the another best investigation. So that will give you an entire picture how the uh, tumor is and where is the extension of the tumor and whether it has gone to other part of the body or not. So whenever there is a cancerous tumor, there are chances it might go to other part of the body. It might, from this glands, it might go to some lymph nodes, which are existing. Around 250 lymph nodes are there in the head and neck areas. So it might go to neck lymph nodes. Some tumors can spread to body also. So liver, lung, bone. One salivary gland tumor known as adenoid cystic carcinoma. So it has a tendency to spread to local area as well as towards chest in the lungs. So once you have a histopathology report which says it is a cancerous tumor, it is very important to check whether it has gone to other part of the body or not. And for that, we do CT scan of chest, ultrasound of abdomen, or we can do PET CT scan, which is the higher most investigation in case of cancerous salivary gland tumors. Now, if the pathologist documented as a benign, it is non-cancerous, then what? Should we take treatment? Should we go ahead with the treatment? Then also I would say yes. It is very important to go for treatment because salivary gland is a peculiar gland. If there are tumors there and if they are slowly growing, especially the benign one, which is pleomorphic adenoma, there are chances after 8-10 years it might convert into cancer, right?
डॉक्टर पूर्वी, आपकी आवाज बहुत ज्यादा ब्रेक हो रही है मैम अभी.
Uh, Sorry. Okay, I'll try again. Let me just check. There are no actually connectivity issue. Is it okay?
It is clear, ma'am.
Okay. So, as I said, like sometimes, yes, you have a simple benign non-cancerous tumors in your glands, but there are chances they might convert to cancerous tumors in 8 to 10 years of life. So pleomorphic adenoma is one entity. It can be converted to carcinoma of pleomorphic adenocarcinoma. So that is a possibility. And that's why even a patient will have a benign tumor, it is important to treat them. That it might, and also when it grows in that area, it might affect other parts of the body and the nerves. So it is very important to treat them. Now, what are the treatment? Surgery is the best modality of treatment for any salivary gland tumor. And surgery is depending on the size of the tumor, extent of the tumor. So sometimes it is not required that you remove entire gland. If the tumor is very small over here, just below the cheek area or here, you can just remove a tumor along with some normal tissue or normal salivary gland tissue, and that is sufficient. It is called adequate resection. Adequate either parotidectomy, adequate submandibular gland excision. So whenever this tumor are there, does not mean you have to remove the entire gland. Then the question comes like how it will be seen if you go for surgery. Then so whenever patient undergoes surgery, they will have a little depression after removal of the gland over here. If the removal of the gland is from here, they might have a little depression, but with the time it goes away. Usually the surgeries are not very risky surgeries, but if the tumors are big and they have involved lot of structures in the nearby area, then surgeries are major surgeries. But if it is small, not major. But we surgeons, we have to preserve the very important structures in the vicinity of this salivary gland tumors. So there is one monitoring system is there. It is called neuromonitor. And most of the surgeons, I think more than 300 centers in India now using this new monitoring when they are operating in this parotid area to preserve the nerve which is supplying the face. Otherwise, the patient will have a facial weakness, deviation of mouth, eyelid cannot close. So in that situation, most of the surgeons, they use this neuromonitoring system. So whenever we are operating in this area, we put that instruments here, electrodes are placed here. Whenever we are close to that nerve while doing the surgery, the monitor will bip, will give you a sound, bip, 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 bip. And it warns us that you are very close to these nerves. Try to preserve those nerves, and that way we can do the safe surgery. So usually the surgeries are very safe in this area. Now, whenever we see minor salivary gland tumors, even so they are mostly inside the mouth, right? So in those cases, we have to go inside the mouth and do the surgeries. And for that, a lot of options are there. If it is they are back inside the tonsillar region or something, we can use robotic surgery. If they are in the palate, lip, then the surgery is we can just do remove simple access surgeries there, and we can remove those tumors. Uh, then the question comes, if we lose one of the salivary gland, will it affect our salivary flow or something like that? So it doesn't happen usually, because the God has given us 6 major salivary glands. So if we take out one also, it won't affect our saliva or salivary flow. Now, usually recovery after surgery is also not a big issue. Patients, they can be discharged on second day or third day after the surgery. But yes, surgery is the mainstay of treatment. If final reports shows, so whatever we remove after the surgery, we send it for the final report, right? It is called final histopathology report. Once it says like the tumor is benign, non-cancerous, then patient won't require any further treatment. They can come for a regular checkup. Yes, regular checkup is important every 6-8 months or maybe a yearly, because once they have developed a tumor, the rest of the salivary gland or the other salivary gland might develop another tumor. So it is important for them also to keep a regular follow-up. If it is cancerous, then the clinicians, they decide whether this patient needs further treatment or not. So if it is cancerous, yes, majority of patients, they need further treatment. It is radiation, and radiation can decrease the chance of this tumor coming back. So it prevents recurrences. And not all, if it is a mucoepidermal carcinoma, low grade, small size, those patients won't require radiation. But yeah, if it is high grade, adenoid cystic, which is little notorious cancer, these tumors require radiation as an adjuvant treatment. So after surgery, they go for radiation. There are no many chemotherapy, or chemotherapy does not have much role in salivary gland tumors till now. Yeah, so some patients we do see with the very aggressive advanced disease where we cannot do surgery, radiation cannot help, and those patients we send them for chemotherapy. But usually the role of chemotherapy is very less. So that's all about salivary gland tumors, and I welcome your all questions for related to salivary gland tumors.
Ma'am, there is one question in the chat box
Yes.
from Abita ji. She's saying, what are the chances of cancer recurring after having a successful surgical removal?
Very good question, Avitaji. So any cancer has a chance of recurrence, and that's why the stages are actually defined. So why we define stage 1, 2, 3, 4, which guides us for the treatment and which also gives us some idea that what are the chances of recurrence. So if patient is having a small tumor and it has been removed very nicely with adequate border or adequate margins of surrounding salivary gland, then the chances of recurrence are very less. But if it is an advanced tumor, like stage 4 tumor, then there is a possibility we remove it, but still patient can have a recurrence in that area and the chances may range up to 40-50%. And not only in local area, sometimes like patient has been treated for like tumor is out, we have given radiation, patient might have a recurrence in other parts of the body. They may develop recurrence in the liver, they may develop recurrence in the lung, and in that scenario the patient survival is little dismal. So if it is limited, we can still reoperate, we can give them a chance for survival. But if it goes to other part of the body, chances of survival are less and they don't do well. We try to control with the tumor if it is spread to other part of the body. I hope this rightly answers your question.
Vaishali, uh, I mean, if there is no further question, let me start asking question to Dr. Puri Madam. Madam, of course, I mean, I've been seeing you, meeting you, and interacting with you in person from time to time. But what I have precisely noticed today, that despite being a surgeon and doing such a wonderful and skillful work, today you presented the entire details or information, in just crystal clear, watery manner. I mean, even any layman can
I
easily understand. Layman can easily understand. Trust me. Even I was. I mean, of course, being a survivor, I was never ever aware about this kind of stuffs about salivary gland
tumor.
tumors and everything, and the way, I mean, even without presentation, even without presentation, you explain everything so categorically well that I mean, it's rather so easy to digest now. I mean, aligning with the previous question of Abita. Uh, are there, I mean, what are the chances? What are the chances of recurrent cancer? I mean, in terms of percentage of salivary gland cancer.
So in general, when we see patients, uh, so stage 1 patients will have chances of recurrence only 10%. If patient is having stage 2, chances of recurrence 20%. So as the stage advances, the chances of recurrence increases. Stage 3, 30-40%. Stage 4 patients will have a 40-50% chance of recurrence. There are patients who presents to us with very big swelling, very advanced tumors. We explain them there are chances of failure around 80%. They will have a chance of, like they will live for 5 years. The chance will be only 20%. So whenever we talk about this chances, it is the actually 5 years time period. So it is not like when I say that patient will have a 10% chance of recurrence. So it will be there for the next 5 years. Patient might develop recurrence in next 5 years. And once they cross some time limit, the probably chances of that tumor recurrence are less. So it is for all cancers. So as the stage advances, the chances of recurrences are very high. And early stage, chances of recurrences are very low. Another thing, those patients who has undergone incomplete treatment, they have chances of recurrence are very high. So if your clinician has advised you to go for radiation and patient is defaulter, patient did not take radiation. So those patients will have high chances of radiation, sorry, recurrence is very high. Inadequate surgery also, because in salivary gland, surgeons play the major role. So it is very important that we understand the disease, we treat it properly, and inadequate surgery can also lead to uh, recurrence. And that's why it is very important that you take a wise decision. If it is cancerous, go to onco surgeon for the surgery.
Thank you. Friends, we at Indian Cancer Society, bringing all these expert speakers, particularly from oncology or cancer specialists, for a very simple reason that, if something is going wrong, don't take it lightly. That is number one. Number two, be aware, and lot of informations are available on various browsers, and therefore, if you are not medically qualified, don't play shot in dark by doing the alternative treatment. Better to consult the best cancer specialist available in your city, in your area, and follow the necessary treatment protocols by default. And let's not forget that, the cancer specialist, anywhere you go, cancer specialists, they are human first, and then they are the cancer specialist and oncologist. And trust me, I am having acquaintances with more than 500 cancer specialists all over the world, and I rather consider them as a human first. And don't forget, they are not your enemy. I mean, they are there to support you incredibly and unconditionally. Say that could be financial factor. Without that, hospitals and cancer centers cannot run. But at the same time, they are offering you life to zero. So don't play with your life. I mean, if there is anything going wrong in terms of anything unusual occurring, and don't try something else. Madam, what I learned so well, which again I was not aware about, is that neo monitoring system. That this is something, I mean, exceptional and incredible, because at the end of the day, while performing surgery, if the situation don't go worse, I mean, while treating cancer or any other stuff.
So
So this is,
So
yeah.
if yes, cancer is involving now, we have to sacrifice. And there are option of doing a plastic surgery also. So neuromonitoring is the one system which helps us to identify now, which is in close vicinity of a tumor. We can dissect, we can gently preserve that now, and we can remove the tumor. And it is an amazing tool. It really helpful to all the surgeons. So we always prefer to have that tool when we are operating. On the safer side, yes, we are skillful, we are confident, whatever. But there is a one more adjunct to it. So that is also very important. Second thing is sometimes we see patients, their nerve is already sacrificed. Like we have to sacrifice because it is involved by the tumor, right? So if the nerve is involved and we have already sacrificed the nerve, the plastic surgeons can take a graft from any other nerve and they can do again neurography kind of procedure and the facial reanimation can be done. So all these are possible things nowadays. Now the as medicine is advancing, tumors biology, we know more about tumor biology. We know more about. We have good facility of this kind of neuromonitor, plastic surgeons availability, so we can do best for our patients.
Thank you, ma'am. Now, one more very important question for entire audience and whoever will be watching this
Sure,
webinar
Shrenik bhai.
later on. Yeah. Uh, please. Uh, I would like you to describe or narrate the role of tumor board, in the oncology sector. This is most important ever.
Yeah. So I don't know whether it has been discussed what is tumor board in this platform or not, but
Not yet.
not yet. So what is tumor board? So what happens whenever a patient comes to a clinic? Like I'm a clinician, patient comes to me, I'm seeing a patient and I'm giving an opinion. That, okay, this patient needs surgery, this patient needs radiation. No, it should not be like that. It should be discussed among the group. So all the clinician, they sit together. So surgeon, radiation oncologist, medical oncologist, three main people, those who are treating a cancer, they sit together. Then radiologist, our pathologist, and they also give opinion. Dietitians, physiotherapists, if they are available, speech and swallowing therapists, if they are available, they all sit together and then they discuss the patient's condition, they plan the treatment and as well as the rehabilitation part also. So this is called tumor board. It is a multidisciplinary kind of management of a patient. Patient comes to my clinic, the case will be discussed amongst all the specialty and then we give a final statement to the patient that way you will need this surgery or you will need this treatment and what will be the challenges you will face, what will be the issues you will face, and how we are going to tackle our other paramedicals staff, how they are going to help you. So that is called tumor board. And nowadays, everywhere, I think many centers in India are also practicing it. They are also conducting tumor board. And there are some difficult cases which are discussed in tumor board of pan India. So all the oncologists across some like hospital chains and they get together in one particular day and they discuss some critical cases, some tough cases, and then they come to a conclusion that what should be done for the patient. And that is always in help. It is not like, yes, I'm thinking this way and I do this treatment. It should not be like that. It is a joint discussion and joint decision for the patient's benefit.
Thank you, madam. This was a very specific question I wanted to ask. Yes, I am aware about tumor board, but then a lot of people, they are rather having impression that okay, doctor has seen and he or she has decided to, operate, etc. So this is what I wanted to emphasize that
Many major
the
cancer centers in India will discuss all the cases in their tumor board. So usually it has become a dictum like all the new cases should be discussed in tumor board and then we have to give a statement of a final treatment.
Yeah, therefore, I would always like to say that, you guys, as a cancer specialist, you are not playing shot in dark. That is for sure. And that is what I admire all your skills and decision making pattern.
Thank you, Shrenik.
Vaishali, if there are any questions.
Sir, currently there is no more questions in YouTube and अभी यहाँ पे भी क्वेश्चंस नहीं है, सो इफ यू हैव एनी मोर क्वेश्चंस या फिर हमारी ऑडियंस जो अभी है कोई कुछ क्वेश्चंस पूछना चाहते हैं तो आप अपने आप को अनम्यूट करके पूछ सकते हैं। अबिता जी का क्वेश्चन है, इज देयर एनी चांस ऑफ
Chances.
हेरिडेटरी एस्पेक्ट?
Uh, Salivary gland tumors, not yet. We have seen a lot of patients with the hereditary impact. Like as we know, breast cancer, yes. Colon cancer, yes. Thyroid cancer, yes. Thyroid is also a gland, but not in salivary. No connection till now has been found that it runs in hereditary. It can be a hereditary cancer. But we do see patients with very young age and having salivary gland tumor, small children. And there might be some genetic uh, alteration might be there, suspected, but not yet proved.
मैम एक्चुअली आई वाज अबाउट टू आस्क द सिमिलर क्वेश्चंस कि जो छोटे बच्चे हैं वो लोग च्यूइंग टबैको वगैरह नहीं खाते हैं, सो व्हाट कैन बी देयर थिंग कि
Yeah,
उनको
so
कैसे हो गया है?
as I told you, no, like there are no cert like in all cases there are no fixed risk factors. In salivary glands, we are still lacking those evidences that why the children all they are developing salivary gland tumors. So ठोस सबूत नहीं है. Like we don't blame on any one factor which can be the cause of the tumors. Yes, we do see some genetic alterations and researches are going on that why these tumors are happening. So probably in next coming 10, 15, 20 years, we will have some identifiable risk factors, possibly pollution or something like that, or some hereditary can come up. But right now, there is no such data.
मैम एंड व्हाट कैन बी डू टू प्रिवेंट इट, एज इन कि जो रेगुलर हम चीजें कर सकते हैं जिससे ये ना हो? ऑब्वियसली च्यूइंग टबैको इग्नोर करना, दैट इज, वो तो कैंसर का, हर कोई भी कैंसर हो सकता है उससे, तो
Yeah, yeah.
च्यूइंग टबैको
Tobacco
अलावा
can cause cancer to any of the organs, I would say. So yes,
ये
obviously we can avoid pollution also if possible. Abhi, like we cannot avoid eating and drinking. Our food and water is also polluted at certain extent, but we don't know how to avoid the eating and drinking. So, but yes, another thing is like if you see any swelling in the salivary gland area, don't neglect it and get it done. Your checkup should be done. If it is benign, you can continue under observation for longer period of time, maybe 1, 2, 3 years. But if it is cancerous, it can be treated early. So that is the only thing we can do in salivary gland. There is nothing we can prevent. Yeah, those who are working in rubber and nickel factories, so those workers should be guided about possibility of this kind of tumors. And so like whatever occupational exposure related norms they have to follow. So that will help them avoiding or preventing this cancer.
थैंक यू सो मच डॉक्टर श्रेनिक सर। इफ यू हैव एनी मोर क्वेश्चंस वी कैन, अभी हम लोग पूछ लेते हैं मैम से, एल्स
Yeah,
You can ask me anytime. You can take my number from Shrenik bhai and we can discuss.
Usually, I mean, I suggest try calling Dr. Purvi ma'am sometime, after midnight, and she will be more than happy to answer your question.
सर एक्चुअली करंटली व्हाट आई एम थिंकिंग इज दैट हम पूर्वी मैम से कांटेक्ट करते हैं अबाउट राइज अगेंस्ट कैंसर ऐप में। मैम अगर हमारे साथ काम करे तो हम लोग को तो बहुत खुशी होगी।
क्यों नहीं?
Definitely, definitely.
अरे
The way
नहीं
on.
नहीं, इसमें वैशाली उनको पूछने की जरूरत नहीं है। I
So
can
he is
I
giving consent on behalf of me.
ठीक है,
I
फिर मैं
think
आपको
I think
सो मैम देन आई लेट यू नो एंड
Sure, sure,
श्रेनिक
sure,
सर
Vaishali.
को भी मैं इंफॉर्मेशन बता दूंगी कि हम लोग कैसे कैसे क्या क्या कर लेते हैं, एंड देन वील कोऑर्डिनेट डेफिनेटली. वीड लव टू हैव यू ऑन बोर्ड.
Sure, sure. So, thank you everyone, and it was nice connecting with you all, Ranjit ji, Sagar ji, Asha ji, and Avita ji, Ravinder ji, Khushi ji, and Vaishali.
Thank
If
you.
I miss someone, like, then just give my regards. Like,
So, thank you. I mean, as usual, yeah. So, madam, I must be thankful to you on behalf of Indian Cancer Society and myself. And as always, I am calling you Sergeant Eden, cancer surgeon with 24 by 7 smile, and truly appreciate it. All your knowledge sharing, expertise, experiences, and we truly value your giving time to Indian Cancer Society, and thank you so very much for being on our Friday's with Shrenik live webinar today. Appreciate it. Thank you very much.
thank you, Shrenik bhai. Thank you,
And
everyone. And if you want our any help when you want to conduct your program here in Ahmedabad, we would be very well ready to help you anytime for your awareness activities.
Definitely,
absolutely.
ma'am. Thank you so much,
Uh,
ma'am.
Thank you. And friends, next Friday we will be conducting new session about gynec and cervical cancer. So to join us for a most insightful and enriching conversation by another cancer surgeon. Thank you so much, and thank you, madam, once again.
Okay. Okay.
Thank you, Shrenik sir. Thank you, Dr. Puri.
Bye.